Millions of people around the world take blood pressure medications every single day. At the same time, omega-3 supplements have become one of the most popular health products on the market, often promoted for heart health, brain function, and inflammation. But here's the big question many patients never ask. Is omega-3 safe to take if you're already on blood pressure medication? Some people assume that because omega-3 is natural, it must be completely harmless. Others worry that mixing supplements with prescription drugs could be dangerous. The truth lies somewhere in between. Omega-3 can offer real benefits for people with high blood pressure, but only when it's used correctly, in the right dose, and with proper awareness. In this video, we'll break down exactly how omega-3 works in the body, how it affects blood pressure, how it interacts with common BP medications, who should be careful, and who can benefit the most. By the end, you'll have a clear, science-based understanding of whether omega-3 is right for you. Omega-3 fatty acids are essential fats, meaning your body cannot produce them on its own. You must get them from food or supplements. There are three main types of omega-3 fatty acids. The first is EPA, or eicosapentaenoic acid. EPA plays a major role in reducing inflammation and supporting heart health. The second is DAR, or docosahexaenoic acid, which is critical for brain function, eye health, and the nervous system. Both EPA and DAR are mainly found in fatty, fish like salmon, sardines, and mackerel, as well as in fish oil supplements. The third type is ALA, or alpha-linolenic acid. This form comes from plant sources such as flax seeds, chia seeds, walnuts, and soybeans. While ALA has health benefits, the body converts only a very small amount of it into EPA and DAR. That's why fish-based or algae-based omega-3 sources are considered more effective for heart and blood pressure benefits. Blood pressure is influenced by many factors, including blood vessel tone, inflammation, blood thickness, and nervous system activity. Omega-3 impacts several of these mechanisms at the same time. First, omega-3 helps relax blood vessels. It improves the function of the endothelium, which is the inner lining of blood vessels. When blood vessels are more relaxed and flexible, blood can flow more easily, leading to lower pressure. Second, omega-3 reduces chronic inflammation. Inflammation plays a hidden but powerful role in high blood pressure. By lowering inflammatory markers, omega-3 helps create a healthier environment inside the arteries. Third, omega-3 can reduce blood triglyceride levels. High triglycerides are often linked with hypertension and cardiovascular disease. Lower triglycerides improve overall heart health and circulation. Clinical studies show that omega-3 can lower systolic blood pressure by a few points, especially in people with mild to moderate hypertension. While this reduction may seem small, even a 3 to 5 mmHg drop can significantly reduce the risk of heart attack and stroke over time. To understand interactions, it's important to know the main types of BP medications people commonly take. One major group is ACE inhibitors, such as lisinopril, enalapril, and ramipril. These drugs relax blood vessels by blocking a hormone that causes tightening. Another group is ARBs, including losartan, valsartan, and telmisartan. These work similarly to ACE inhibitors, but through a different pathway. Beta blockers, such as atenolol and metoprolol, lower blood pressure by slowing the heart rate and reducing the force of contraction. Calcium channel blockers, like amlodipine and verapamil, prevent calcium from entering heart and blood vessel cells, leading to vessel relaxation. Finally, diuretics, often called water pills, help the body get rid of excess salts and fluid, reducing blood volume and pressure. Each of these medications lowers blood pressure through different mechanisms, and this is where omega-3 interactions become important. Omega-3 does not directly block or enhance blood pressure medications in the way drugs interact with each other. However, it can add to their blood pressure lowering effect. This means that when omega-3 is combined with BP medication, blood pressure may drop slightly more than expected. For many people, this is beneficial, but for others, especially those on higher doses or multiple medications, it can cause blood pressure to go too low. Low blood pressure, also known as hypertension, can lead to dizziness, lightheadedness, blurred vision, fatigue, and even fainting. This is why dosage and monitoring are essential. With ACE inhibitors and ARBs, omega-3 may enhance the blood vessel relaxing effect. This is usually mild, but in sensitive individuals, it can lead to excessive BP reduction. With beta blockers, omega-3 is generally safe, but in rare cases it may contribute to a slower heart rate or increased fatigue. With calcium channel blockers, omega-3 is usually well tolerated. Most patients experience no negative interaction though. BP should still be monitored. With diuretics, omega-3 can sometimes contribute to weakness or dehydration if fluid balance is not maintained properly. The most important interaction is not with BP drugs, but with blood thinners. Omega-3 has a mild blood thinning effect. It reduces platelet aggregation, which means it makes blood less likely to clot. This is good for preventing heart attacks and strokes, but it can become a concern when combined with medications like aspirin, warfarin, or clopidogrel. In high doses, omega-3 combined with blood thinners can increase the risk of bleeding, including nosebleeds, gum bleeding, or easy bruising. This does not mean omega-3 is dangerous, but it does mean high doses should only be taken under medical supervision. For most people with high blood pressure, omega-3 is safe when taken in moderate amounts. A daily dose of 250 to 500 mg of combined EPA and DAR is enough for general heart health. For additional triglyceride or BP benefits, up to 1000 mg per day is commonly used. Doses above 3000 mg per day should not be taken without a doctor's advice, especially if you are on BP medications or blood thinners. Getting omega-3 from food, such as eating fatty fish 2 to 3 times per week, is considered the safest and most natural approach. People who should consult a doctor before taking omega-3 include those with very low blood pressure, those taking multiple BP medications, individuals on blood-thinning drugs, people with bleeding disorders, and anyone preparing for surgery. Pregnant women and people with chronic liver disease should also seek medical guidance before starting supplements. Despite these precautions, omega-3 offers several advantages for people with hypertension. It supports overall heart health, reduces inflammation, improves lipid profiles, and may enhance the effectiveness of lifestyle changes like diet and exercise. Omega-3 is not a cure for high blood pressure, and it should never replace prescribed medication. But as a supportive therapy, it can play a meaningful role in long-term cardiovascular health. Omega-3 and blood pressure medications can work together safely and effectively when used responsibly. The key is moderation, awareness, and communication with your healthcare provider. Natural does not always mean risk-free, but informed use makes omega-3 one of the most valuable supplements for heart health. If you have high blood pressure, omega-3 may be a helpful addition, but only when it fits your individual medical situation. If you found this video helpful, make sure to like it, share it with someone who has high blood pressure, and subscribe to the channel for more evidence-based health content.